In the early to mid 90s, basically physicians were getting tired of the politics of hospitals. They wanted to add a chiropractor, which again in the 90s was extremely unique.
What are some of the common misconceptions you think?
I think a lot of times chiropractors in general get frustrated with it. They don't know what we do. Well, they're not taught that in their medical program, so how would they?
Walk us back to your injury, how you felt.
When you go through something like this, you can totally understand what a patient's going through. In 2006, because I was working at the ortho, we were trying everything. It was a Friday night at decompression. I woke up Saturday morning with more pain than I've ever been in my life.
And you can imagine a patient that would have had that done. What would they have said?
Never go back to that
place. Don't go back to that quack. They almost killed me. Welcome to Bending Over Backwards with James Adkins. I'm your host, Dr. James Adkins, where each week we take a deep dive into what it takes to break through barriers and change the game, whether that's in medicine, business, or life. And today I'm sitting here with my colleague, Dr. Eric Neufang, who has been through a lot. I'm excited to get into this today because you're a spine doctor who's been through a horrific spine issue. And you've seen the worst of it. So I'm excited to get into that today. But I first wanted to talk with just you, Dr. Neufang, introducing us to where you're from and how you got your start in your profession. And
sure.
Take us back.
Thanks for having me on.
You bet.
From Syracuse, New York originally, and decided at the age of 18, 19, what are you going to do with the rest of your life in college? And wanted to get back to the profession that gave me so much, which we'll get into today.
Okay.
But yeah, went through undergrad and got my biology degree and went to chiropractic college, practiced in New York. I was one of the first, if not the first chiropractor to practice in a immediate care medical center in upstate New York.
Okay.
Back in the 90s. And decided I wanted 300 days of sunshine a year, so
moved to Arizona.
Sold my practice and moved to Arizona in 2003.
It is a different type of environment that you work in today as a chiropractor in a spine and pain program, but it's not as unique as it was back in the day when you started, is it?
No, not at all.
Yeah. So you were working in an acute care musculoskeletal practice? Was it an urgent care? Is that what you're working in?
So in the early to mid 90s, basically physicians were getting tired of the politics of hospitals. Mm-hmm. And at the time it was a unique idea. Now, not so much, but they broke away from the hospital and the physicians building and opened up their own center.
Okay.
So it was a 100,000 square foot facility. They had urgent care in every profession, from physical therapists to cardiologists.
Okay.
And they wanted to add a chiropractor, which again in the 90s was extremely unique.
Yeah.
And I was approached and asked, and some were very open to it, some not so much.
Yeah.
That a chiropractor was practicing in a physician's building.
Mm-hmm.
But it was great. Within 3-4 years, I would say I was averaging 20 to 30 new patients a month, and it was all MD referrals. It was a great time to practice.
There's a lot of misconceptions about the chiropractic profession, and I'm interested in how do you think you're working in a multi-specialty spine program and pain program like you work in? How has that informed your understanding of misconceptions of chiropractors, working with medical physicians all day long? What are some of the common misconceptions, you think?
It boils down to education. I think all too often as chiropractors, we don't educate our patients. We don't take time to educate physicians. And I think a lot of times chiropractors in general get frustrated with it. Mm-hmm. That, they don't understand, they don't know what we do. Well, they're not taught that in their medical program. So how would they?
Sure.
And if you don't educate your patient on exactly what's going on with them, exactly what you're doing for them, and then they go back to their primary care and say these crazy things, you can't do that. So I take a lot of time educating my patients. I practiced in an orthopedic surgeon's office, and one of the pain management doctors said to me, "Why does every chiropractor adjust the neck, even if it's a low back issue?" So, well, no, we don't. But that was a
Interesting.
conception that they feel that every chiropractor does this.
Kind of the old school head to toe type of way of taking care of patients.
Absolutely.
Yeah.
And, you know, when a new patient comes in, I'll ask them, have you ever been to a chiropractor? Because I want to know, what are you used to? And I often say, if you go to a cardiologist in Miami or Anchorage, you're going to get the exact same treatment. The bedside manner might be different, but the treatment is going to be the same. You can come to me and you can go to a chiropractor across the street, and it's night and day.
Yeah.
And unfortunately, it just is what it is in our profession. You know, at the time that we graduated, I think there were 14 schools, and 3 of them could be completely different than the others.
Yeah.
So I think as practicing providers, we need to find out, okay, what do you know, what don't you know, and educate as much as possible.
I want to go take you back to your injury, because this is really I think patients when as you know, when they see a practitioner, a doctor, or another patient that's been through what they've been through, I think it gives them a lot of confidence. You know, I think when I had my spine injury and I went back to seeing patients, I was a lot more empathetic, and I could relate with my patients a lot. I was a lot more kinder and gentler than before I'd had my disc injury. But you know, walk us back to because most I think a lot of people that have a spine issue think it just happens one day. It usually doesn't, right? It's usually it develops over years. Typically, some people have injuries and accidents, but most of us have a degenerative thing that happens over several years, and patients deal with that in different ways. But walk us back. I mean, a doctor going through, you went through it all. I mean, you went through the conservative aspect of spine care, the most aggressive intervention, and all the side effects. And you know, walk us back to your injury, how you felt mentally, and when it happened, and you know, a little bit about the history.
Yeah. So you certainly wouldn't wish this on anyone, and you hit the nail on the head. When you go through something like this, you can totally understand what a patient's going through. It's not something you can read in a textbook and understand a patient's pain.
True.
Neurogenic pain is like nothing else. It is debilitating. And when it becomes chronic, it can be very depressing. Back in 2006, I was back home visiting, and we had a freak snowstorm. And I was at our cabin, and there was plexiglass underneath wet snow, and I didn't know that. And I hit that, went up in the air and fell, laughed it off, you know,
Sure.
you fall, you know, kind of comical. Well, within 2 or 3 days after that, I was flying back home, and I had sharp burning pain in my left glute.
Okay.
Within a day of being back here, I had foot drop. And
Big problems.
luckily for me, I was practicing at the time at one of the best orthopedic surgeons in the Southwest. So we went through conservative care. I tried everything humanly possible, what I thought everything was at the time. So
And conservative care would be for
chiropractic, physical therapy, medications. And at the time, growing up, I never did hard drugs. I never tried anything like that. So trying narcotics was certainly something totally different and not what I was used to. And unfortunately realized that I had a very high tolerance. So it took massive amounts for me to get any relief.
And you were still practicing, right? I mean,
Practicing every day.
and in a very physical profession.
Yes.
You know, like an orthopedic surgeon standing over an operating table, or a chiropractor standing over a patient, lifting patients. That's hard on your body.
Having to put on a smile and trying to grit through it, and you know.
So you're doing what our patients try to do. You're trying to take medicine, trying to stay with it, trying to stay on your job. Don't want to lose your job.
Trying to do everything I could.
And afraid of pain medicine.
Yeah.
Like we should be, and your training especially makes you more opposed to using pain narcotics.
Yep. Certainly not something that you want to do, but it was the only thing that gave me relief at the time. Went through several injections. I remember it was...
And about injections, I want to slow you down there, because a lot of our patients are getting those, aren't they? So many of our patients in our practice are getting injections every day, because we work in an interventional spine and pain program.
Yep.
But walk us through some of the fear, right? If you're a doctor, but what about the patient who shows up, they've got this problem, they're going to get an injection. Kind of walk us through what relief you got, kind of how your experience with that.
So not to fast forward, I actually have 3 disc herniations, 2 in my low back, 1 in my neck. So I probably have had about 15 transforaminal injections.
Epidurals.
Yeah. And I walk through patients because, again, a lot of our patients are going to go do that. They don't know what to expect, and they're scared, and they shouldn't be. If it's a good practitioner, it's an art, and I certainly recommend
board certified, fellowship trained, interventional pain.
And it's a safe environment, and you need to, again, going back to education. Sometimes injections work, sometimes they don't. There's no rhyme or reason. And just because you had 3 injections a year ago and it didn't work doesn't mean that service isn't going to work for you in the future.
That's such a good point. It's kind of in spine care, when we think about the silos people work in anyway, people have a tendency to describe spine provider, or, it's kind of like, I tried the pain doctor. I tried the physical therapist. I tried the chiropractor. Well, those are professions. Those aren't treatments.
Yep.
Right? The skill level between different chiropractors is radically different, and it is with interventional pain physicians, right? So I think that's a good point. Your point of you get injections for a spine problem doesn't mean just because you had them one time.
It doesn't
mean that 3 months down the road or 3 years down the road, a different level, a different condition could be a great treatment to prevent a fusion. Prevent a spine surgery.
And I can tell you, so for my cervical disc issue, my last injection was 2009. Knock on wood, I haven't had any issues really since.
So 16 years.
So yeah. So
now, were you scared of getting a neck? I mean, again, I know you're a doctor, but were you scared of getting an injection in your neck?
So funny story with that. The one time I did go, for whatever reason, it was middle of the week. I didn't have a driver. And I told them, just go ahead and do it.
No sedation.
I would not recommend that. That was not a pleasant experience. That was one of the
because you don't want to choke your head.
No, it was one of the most painful things. And I'm not
being
saying,
honest. This is for people's benefit.
Yeah, I'm not saying injections are painful because you do have a little bit of sedation. That one I had none. And
so your point is in the neck. Maybe consider getting sedation.
Yeah, get a driver.
Okay.
Yeah, somehow. Well, now we have Uber and Lyft.
That's right.
But so going back to what ended up being my first back surgery. So in 2006, because I was working at the ortho, we were trying everything. I tried, again, going back to the conservative measure. So I did decompression. It was a Friday night. I did decompression. I woke up Saturday morning in more pain than I've ever been in my life.
So the decompression, for our listeners, the benefit, that's a specialized table that physical therapists and chiropractors...
This should be used for chronic discs, not for acute discs, and it inflamed the heck out of
So pulling on your back when your disc was really inflamed was a very bad idea.
Yes, it was.
And
I just thought I'm trying everything, so I try this as well.
And you can imagine a patient that would have had that done. What would they have said?
Never go back to that practitioner.
Don't go back to that quack.
Yeah.
Don't go back to that crazy doctor. Don't go back. They almost killed me.
Yep.
So now everyone who's got a spine problem is afraid of seeing the physical therapist who treated you, or the chiropractor who treated you.
Absolutely.
Yeah.
So I called the pain management doctor Saturday morning.
So you're in trouble.
I was
in the leg, in the back. I mean, is it kind of everywhere, or where were you?
Immense burning, shooting, stabbing pain in my leg.
That's real nerve pain.
Yes.
People have arthritic back pain, and that's severe too. But nothing like nerve pain.
No, mechanical back pain and neurogenic are two completely different entities. And I had to wait till Monday. So Monday morning we went in, and when the steroid of the injection hit that nerve, he actually had to pin me down on the table as how much pain I was in.
Oh, my goodness.
The only way I can describe it is it felt like my foot was in a box of hot coals.
Were you sedated?
Yes.
So you're sedated and it still hurt that much? Wow.
So after that experience, I walked into the ortho's office, sat down with him, and I said, talk me through the surgery and what you're going to do.
So you got no relief. Sorry to interrupt you, Doc.
None.
You got zero relief.
None.
So now you're mentally, walk me through how you felt mentally, because you're still trying to save your practice.
The story's going to get worse.
Okay.
So, Dr. Doring walked me through the procedure.
Yeah, Doring's a great spine surgeon.
Phenomenal.
Yeah.
Phenomenal. I can't say enough about him. Walked me through what a microdiscectomy actually is, and he doesn't cut muscle tissue. You basically work a tube around the muscle, find the extruded disc, put a instrument through that's going to suck out that material, sews you back up. You're in recovery for 45 minutes to an hour and a half. You're back doing your normal things. So I said, yeah, sign me up for that. So because I had worked there and I was in great shape at the time, we didn't do any cardiac workup.
Uh-oh.
So
how old are you at this time?
35, 36.
Yeah, you're fit. You're an athlete.
Yeah,
no reason.
There was no reason.
No reason.
And none of us thought that there was a reason. So I get scheduled for the surgery. I go in for the surgery. They put me under, and they wake me up immediately. And I have a orthopedic surgeon, a physician's assistant, and an anesthesiologist standing over me, white as ghosts.
Uh-oh.
My heart rate went up to 160 beats per minute.
Uh-oh.
So they said, we can't do the surgery. You need a full cardiac workup. Now, I'm in excruciating pain at this point.
And now you have anxiety, severe anxiety, like you already did anyway. But now it's multiplied.
So a month later, after doing a full cardiac workup.
A month later?
Yeah. A month of outrageous pain. Cardiologist determined I was stressed out, take a multivitamin. That's literally her exact words.
Wow.
Diagnosed me with ventricular bigeminy, which has now been re-diagnosed as atrial fibrillation. It's a side thing. But
so I want to slow you down there. So a month. And this is a problem. This is the problem our patients are going through. You got neuropathic pain. You've gone in for a procedure. It didn't work. You couldn't do it because of and now you got 30 days to take oral medicine, keep your practice alive, deal with the anxiety, the fear, and you're just sitting. I mean, that's
At this point now, the medication has been upped quite
Were you
a bit.
Depressed?
No, I was frustrated.
And angry, anxiety.
Just in so much discomfort. And then we found out why. So when I finally went in for surgery January 27th, not only was there a disc herniation, but I had punctured the dura mater. So I had a hole.
So you had a dural leak?
Yes.
For a month?
Yes. I think the decompression basically did that at that point.
So your head... you must have been having horrific headaches beyond.
Didn't know I was on so much medication.
You didn't even know it. You're walking around with a dural leak.
Yeah. Had surgery on a Monday. By Friday, I was cold turkey off all medication. My pain was gone. Within 7 weeks, I played in my first softball tournament.
Wow.
I would not recommend that. But yeah, it was a success story. Unfortunately, like an idiot, I went back to doing all the things that I was doing prior to the surgery, and 9 years later, developed foot drop on the right foot. We went back in, had surgery again, and I've been fine. Knock on wood, I've been fine since.
Same type of just a discectomy, or did you have no stabilization? So at the same level, did you have
same exact level?
Same exact level. Okay, so you're a success story, but some patients get in that trap where the epidural didn't work, the surgery isn't effective, and then they're stuck, aren't they? And then we label them and we say this guy just wants medicine, or this guy doesn't want to work, or
he's in pain.
He's in pain.
Yeah,
it's real.
Yeah, and again, going back to what you were saying, I can relate to that because I've been there. And if it's hope for patients, it's hope that you're sitting across the table from someone who has been in your situation, who has gone through it, and the fear,
again, I know you're trained, so that could be good and bad. The bad side effects and the good stuff that goes along with it. But the fear is pretty palpable in that when you're in that scenario, isn't it?
I think as soon as you bring up the word back surgery, people start thinking it's a fusion. And it's not. There's a lot of different options out there, and
we prevent a lot of fusions in our program.
Absolutely, and I try and discuss that with patients. That is an absolute last resort. Mm-hmm. If you have instability, okay, yes. Yeah. If you have multi-level and you've gone through everything, there's a time and place for everything, but that is an absolute last resort.
And as we know, and I know as a patient sitting here, severe instability in my lumbar spine. I've had what you've had, stenosis and foot drop, and by the grace of God and good doctors, I was able to prevent having. Unfortunately, fortunately, I didn't have the surgeries you've had. But I can tell you that I have to train my core every day.
Absolutely.
And I'm sure you do. It's not I can't do it 3 days a week. I can't do it 4 days a week. If I don't train my core every day, I'm going to be in our office getting epidurals, and they're going to be fusing me, because I can do what I want. I can kite surf and snowboard and do all those things, but I have to train my core every day. And that's the one thing that's your role in our clinic, is trying to teach our patients how important stabilization is.
And that brings up another good point. I have a lot of patients who are worried that they're not going to be able to do the things that they love. And I try and tell them that, even after my entire scenario, I still lead a very
you're a serious
active
athlete.
life. Yeah, I still, I still participate in tournaments. I
Competitive
still hike.
competitive
I
softball.
just played in
right?
a tournament I played 9 games this past
And
week.
softball, you're rotating and swinging your upper body,
Rotating,
right?
diving, sliding, still doing my age, still doing all those things. Still hiking, still went to the gym last night.
Yeah.
So you can still lead a very active life. There's certain things that you might want to veer away from. I used to love horseback riding. I don't get on a horse anymore because, again, if you get bucked off,
Sure.
you can really hurt yourself. So it's picking and choosing your activities, but that doesn't mean that you're limited to a life of just sitting on a couch.
Yeah.
You can stay active, and you're absolutely right. You have to activate your core, and core stabilization exercises are imperative for patients to continue.
To prevent you from having that fusion that
Yep.
you don't want to have. I mean, you've avoided it. You've successfully avoided it. I've successfully avoided it, knock on wood. So far.
So far, so good.
But I think that's in our minimally invasive spine practice. That's what a lot of people are seeking, aren't they?
Absolutely.
They've had, if we can inject them and do some chiropractic adjustments on them and train their core, that's the best thing ever. That's what we do most of the time. But there are those patients that the nerves get too tight in the spaces. The stenosis gets too bad, or the herniated disc gets too bad, right? And we do have to, some of those patients, decompress them. The nice thing is that your message, they can still go back to a lot of their normal activities if they're willing to train their core.
Yep. And continue treatments.
Yeah.
There's a lot of different things out there. And when patients come in and say, well, I've tried everything. No, you haven't. Between chiropractic, physical therapy, red light therapy, we've talked about PEMF in the past, shockwave therapy. I mean, there's so many, acupuncture, there's so many different things out there that you can be trying and doing. And I tell patients, try all of it. It's not a one thing approach that miracle pill is going to take care of you.
When you had that, again, mechanical back pain and neuropathic pain are different. As you could give a dissertation on.
Yep.
I could too. What helped you the most with your neuropathic pain? I know it was over a period of several years, and at different times different things worked. But was there one thing that you felt gave you the most relief?
So from the neurogenic pain, having the surgery
was the best thing,
because that's literally what was that microdiscectomy is what really took that away. Bounced back pretty quickly after the first one. The second one, I had so much scar tissue, and I didn't discuss this. When he went in for the second one, he literally had the hammer and chisel away at scar tissue to even get to the disc.
Well, did Ed do both of those? Dr. Doran do both your surgeries? Yeah, it's good to have a good surgeon.
Absolutely. Yeah. But unfortunately, because of that, I was in a lot more pain post-op for the second one than I was when I
And what did you do?
in.
I mean, I obviously use oral medicine, but what did you do? Physically, anything? Was there anything that helped you?
Again, did chiropractic,
And with chiropractic, what were they doing primarily?
At the time, instrument adjusting, not high-velocity rotation of the spine, which...
And you was in PEMF, too. You talked about that quite a bit.
So after 2017, after about 3-4 years post-op of the second one, my pain level was still a 3 or a 4. Just daily, I mean, it wasn't immense pain, but it was more mechanical pain. It was dull, achy for the listeners. And I rented space out to a gentleman who did a lot of recovery services, and he had something called pulse electromagnetic field therapy, PEMF. I was not familiar at the time about it. I started doing that, and literally my pain level is a 0.
So that helped
I
a
have
lot.
no back pain at all anymore.
And we use those in the clinic, as you educated me. I didn't even know. We use them in our clinic
For bone stimulation.
for bone stimulations after
Yeah,
surgery.
it's the same technology.
So healing the tissue prior to surgery to prevent it, and then also if you have to have a surgery, using it afterwards. This technology.
Yeah, it's extremely, anytime you come across anything that NASA developed is pretty interesting and pretty cool from a scientific standpoint. And anything and everything that I've always utilized in my practice is
Evidence-based.
evidence-based.
Yeah.
I mean, I'm pretty skeptical, and I think that just comes from a scientific background of, okay, yeah, it works, how?
Yeah.
And PEMF is not some new-aged thing. It's been around for 50, 60 years. Ton of white papers on it, and it really has made a difference.
Excellent.
And I'm a firm proponent of it.
Excellent. What message would you have for two practitioners? One, a spine surgeon who is trying to get to work with, understand how a chiropractor works, and then also, I guess, for a chiropractor to work with a spine surgeon, because you've lived in that, you've chose to live in that intersection where you work with interventional pain physicians and spine surgeons. And but how would you, what would be a simple message for a spine surgeon and a chiropractor to get them to, because society needs this. They need different spine care professionals to break down those barriers, right? Those silos, and work together, because the patients benefit. The evidence proves that interdisciplinary pain practices work better, right?
And the research behind that goes back 20, 25 years ago. And for whatever reason, we're still ignoring it. It is a healthcare profession.
Well, that's medicine, isn't it? The evidence comes out, and then there's a 10-year gap before doctors actually adopt it. And then in that 10 years, the patients suffer.
Absolutely. And it's too bad, because, again, it should be an all approach, all hands on deck for the patient and getting the patient better. And instead of this piecemeal approach, let's treat the patient with injections, with conservative chiropractic care. Yeah. And then if they fail all that, then surgery is certainly there. But, going back to your original question, I think, again, it boils down to education. Take the time and sit down with each other and actually figure out what you guys actually do. Instead of these preconceived notions, well, I think chiropractors do this, or I think every surgeon just wants to do surgery. No, they don't. There's a lot of surgeons out there who are very conservative.
We work with some. You're right.
Absolutely, in our practice, absolutely, 100%. And
Dr. Rafet Beg has done great work for us with our patients.
Yep.
He's great.
And again, if it comes down to a surgical situation.
Yeah, and what we're talking about that too, we won't get into that too much. That I'm not a surgeon, but you talked about the minimally invasive. We work in a minimally invasive spine practice, and there is a difference between a open laminectomy discectomy, as you know, and endoscopic or a camera-based, same day type surgery. And I think today patients are looking more for that same day type surgery, that ultra minimally invasive approach when it's necessary, or when it's applicable.
Absolutely.
It's not applicable for every scenario, as you know. But what's been your experience working with minimally invasive spine approach versus an open approach?
Again, it gives the patients relief. Going back to what you were saying as far as the anxiety of patients, if you can talk to them and let them know, this isn't something that you're going to be, in a couch for 6 months in a brace.
It's really advanced. The surgical techniques have advanced.
It's so much more advanced now, and the recovery time is great. And that's what people, at the end of the day, that's what people really want. They want to get back doing what.
And we've learned with the recovery, haven't we, to get those patients moving fast.
Yep. And again, that's where those two professions,
so true.
Someone can have surgery, and you want to get them back doing the things that they want to do, and that's where you can have a good chiropractor or physical therapist come in and do those things.
And when they work on a spine team, the patients benefit. It's amazing, the benefit to the patient. I can remember this specific conversation with spine surgeons of starting rehab 6 weeks after the surgery versus 6 days.
Yep.
6 days is a lot better for the patient. But
Well,
still
not only
today,
that, 6 weeks is depressing for the patient because they're doing nothing for 6 weeks.
sitting at home, worried,
Yep.
afraid of losing their job, taking medicine, sitting, not interacting with society. Yeah. Any other last pieces of advice for a spine case for a spine patient? Give us some advice. You've lived it.
Come to Arizona Pain Treatment Centers.
Yes, sir.
Yes, 100.
Yeah.
100%. Again, it's been a great environment. I've been there since January. Couldn't be happier.
Thanks.
The team is phenomenal there. Everyone there. Yep.
Thank you. Well, I hope today's episode helps you stand taller in your own shoes. I hope you learned something today from Dr. Neufang. If we can assist you, please reach out to us at Arizona Pain Treatment Centers or 602-265-8800. Thank you.